This is the final lecture, lecture 22, muscles of the face, head, and neck. We first need to look at some terms. The muscles in our face are known as mimetic. They're different in that they primarily move skin rather than bones. And if you know the word mime, mime is performing without actually speaking, making faces. So mimetic. The other terms, two terms, if you look at this picture, canthus, canthi is plural, and sulcus. You see these grooves. So what are each? Sulcus is a groove, crevice, or furrow. In medicine, there are many sulci, as for example, the superior pulmonary sulcus. Sulcus is the Latin word for groove, furrow, or trench. Canthus is the angle formed by the meeting of the upper and lower eyelids. So let's go back to this picture, and you can see the sulci. That's where the word sulking came from. Sulci are the grooves. Canthi are between the upper and lower eyelid. And so we have differences. Now there's 5 groups of facial muscles, and we're going to go one group at a time. The first group centers around the mouth, then around the nose, eyes and forehead, ears, and then we're going to look at the muscles that we held off on that are in the neck. So let's look at the mouth first. And we're going to go some of them in pairs because they're on both sides. So let's start with depressor anguli oris. Pulls the corner of the mouth downwards. Depressor labii inferioris pulls the lower lip down. So these pictures that I'm going to show you, on the right, of course, is the muscle drawn in, and on the left is a drawing of a subject. The source that I got it from decided to colorize a picture rather than showing a regular photograph. But either way, okay, this young lady who they got to do the poses, I hope she made a lot of money because you can see as we go along, she's able to do some pretty fancy things with her expressions. Depresses and laterally draws the angle of the mouth. Right here, depressor anguli oris, the angle of the mouth. Just the lips alone, depressor labii inferioris, depresses and laterally draws the lower lip. So you can see it's 2 different muscles. This is just the lip. Then the risorius pulls the corner of the mouth laterally, and zygomaticus, major and minor, pulls the corner of the mouth upwards and laterally. So this is the risorius, draws the angle of the mouth laterally. Now that's not a smile. Some people will call that a smirk, but this is the risorius. Now, the zygomaticus minor elevates the upper lip, and you can see it. The zygomaticus major, different muscle, now looks like it's leading to a smile. Elevates the angle of the mouth, draws the mouth laterally. So you can see that looks like a regular smile. Zygomaticus major. Then we have the levator anguli oris, the corner of the mouth, just like we had the depressor. This is the levator anguli oris. And similarly to the depressor labii superioris, this is the levator labii superioris, pulls the upper lip upward. So levator anguli oris elevates the angle of the mouth. That looks like a snarl. Huh? And lifting the lips, upper lips up, levator labii superioris. And we got a few more centered around the mouth. The big one is the orbicularis oris. Circles the mouth and closes the lips. And part of the cheek, the muscular part of the cheek is the buccinator. So here's the orbicularis oris. Closes the mouth and protracts the lips. And I always say, if you're going to give somebody a smooch, we are using our orbicularis oris. Buccinator. And you see where it is on the cheek. Compresses the cheek against the teeth. And people who play instruments that need to blow, especially all wind instruments and brass instruments that we actually blow, have to use the buccinator. And then the mentalis, this is down in the lower lip, wrinkles the skin of the chin, the mentalis. Now let's go to the nose. You have the nasalis, small, flares the nostrils. Depressus septi nasi constricts the nostrils, so the opposite between the two. So this is the nasalis, makes the nostrils bigger. And the reverse is depressor septi nasi, closes the nostrils, constricts the nostrils. Two different opposite movements. Then we go to the eyes and the forehead. Frontalis wrinkles the forehead transversely, and the occipitalis moves the scalp anteriorly and posteriorly. A lot of times they lump it together and call it occipitofrontalis because you see the muscles in the front and the back draws the scalp anteriorly and posteriorly when these muscles contract. It elevates the eyebrows as well. That's why it is the occipitofrontalis. And around the eyes, just like the mouth, orbicularis oculi, responsible for closing the eyelid. It closes and squints, depresses the upper eyelid, elevates the lower eyelid. Orbicularis oculi. And what about the skin between the eyebrows? Pulls part of the skin between the eyebrows downwards, which also assists in flaring the nostrils. So it's called the procerus. See that? The procerus. And can you see it's also expands the nostrils, but wrinkles the skin of the nose. And that's an expression that's not uncommon. Procerus. There's a muscle called the corrugator supercilii, draws the eyebrows inferiorly and medially, produces the vertical folds between the eyebrows, the worried look. You see that? That's called the corrugator supercilii. Draws the eyebrows inferiorly and medially. And here's another picture of that. The eyebrows inferiorly and medially. The corrugator. And here's the procerus in the middle. And we have the palpebrae superioris, elevates the upper eyelid. It's like that, right? Opening eyes, showing astonishment, elevates the upper eyelid. Levator palpebrae superioris. And now we have group 4, the ears. Auricularis, those are the muscles that control our ears. And in humans, not usually under voluntary control. That's why we say rudimentary in humans. Lots of animals can flap their ears, like elephants and dogs, cats, they all can move their ears, but in our case, it's not usually under voluntary control. And then we have the temporoparaetalis. Temporoparaetalis elevates the ear. So here's the auricularis. We have one on the top, front, and the back. And you can tell why animals can move their ears quite a bit. All three muscles can work. And here's the temporoparaetalis, right over the temporal bone. And we're down to the last, superficial neck area. Now the platysma is a gigantic muscle. Vertically oriented, extends from the upper thorax to the mandible, all the way up to the lower jaw. Tightens the superficial fascia of the neck. And you'll see a picture and you'll know exactly what we're looking at. Depresses and draws the lower lip laterally. Look at that. This is the platysma. And you can do that if you tighten your cheeks and put your chin forward. You can draw the skin of the superior chest and neck, creating these ridges. There's the ridges, the platysma. Big muscle. Huh? And now we have muscles for chewing, which we'll go over pretty quickly because we know that they can move our jaw. I'm not going to ask you too much about these, but they're called the temporalis, the masseter, lateral and medial pterygoids. The P is not pronounced pterygoids. So I said be able to identify the locations. There's the temporalis and the masseter. See, these are the pterygoids to be able to move our jaw. What do they do at the mandible? This is important to know. Opening the mouth is called elevation. Depression is closing the jaw. Protrusion is pushing our jaw forward. Retrusion is pulling our jaw back. And then if you're chewing gum, of course, lateral exclusion. Huh? So here we are, three muscles to close the jaw. Temporalis, masseter, and medial pterygoid. Once the jaw is closed, the only muscle available for opening is the digastric. And the opening is also helped by gravity. So we are much stronger with our jaw closed. So I'm going to show you this picture of an alligator farm. And because the alligators, and it says crocodile, so it is a crocodile farm. This is a picture of a guy handling crocodiles. Why is he pretty safe? Because once the jaw is closed, the crocodile has a tough time opening it. If it's open, then it's very hard to stop it from closing. Much stronger, but opening, they're very weak. And that's why you can see what he's doing. The pterygoids, this is the lateral pterygoid, and you see the arrow going forwards. Retrusion. This is protrusion, is going forwards. Protrusion. Retrusion is pulling our jaw back. And lateral excursion, when we're chewing, we can move our jaws sideways as well. And now we have a very important joint, the joint that we move our jaws around. This is called the TMJ, or temporomandibular joint. Synovial, surrounded by a capsule, and the capsule is attached to the temporal bone above and the neck of the mandibular condyle below. Can you see this? This is the TMJ right here. Now, we talk about it particularly because if this gets dislodged, it's very, very painful. TMJ syndrome, extremely painful, and that's what this picture is indicating in red. Now, why is the TMJ also very different? Is the surfaces are covered by fibrous connective tissue. And fibrous connective tissue is better suited for shear forces, that is, sliding one over the other. Usually, joints are lined with what? Hyaline cartilage, right? That's what our joints are. Shoulders, spine, hips, they're lined with hyaline cartilage, and they can handle compression, but not sliding over each other. Fibrous connective tissue can do that. That's why our jaws are built the way they are. Two types of movement: hinge or rotating, opening the jaw. Rotation takes place in the sagittal plane around the x-axis. And then the other thing we can do is gliding. That's why we can push our jaws in protrusion and retrusion. Takes place in the transverse plane. Last thing are the sternocleidomastoid muscles. And these are on the side of our neck. And we're going to look at the origin and insertions because it's a very prominent muscle. The last origin and insertion for the class. Sternocleidoid, origin is the manubrium on the ribs, and the insertion is the mastoid process behind the ear. And we're told the action is a powerful head and neck flexor. So the origin is on the manubrium, and the insertion is right there, and it's called the mastoid process. So if you look at the bone, we got a thing that sticks out in our skull called a mastoid process, and that's the insertion. Now, one more thing here, a clinical note again. Torticollis is what we call a stiff neck or wry neck. It's caused by an abnormal position of the head. And it's caused by excessive contractions of the sternocleidomastoid. The trapezius also can be involved. So you get a stiff neck, wry neck, torticollis, clinical term, is because you stretched the sternocleidomastoid and put it in an awkward position. And here, a real quick look at the muscles that we use to open and close our mouth and chew. Now, we have muscles that lift and raise our ribs. So we're going to look at the ribs, the scalenes. These are the anterior, middle, and posterior scalenes. And you can see these are the scalenes. First of all, let's look at where they originate on the transverse processes of the cervical vertebrae. We know where these are. And insert on the ribs. They lift our ribs cage up to expand the chest. So what do? They flex the neck laterally or turn to the opposite side and raises the ribs in forced inspiration. Fixes the ribs in quiet inspiration. So when we're really working out, the scalenes come into picture, lifting our ribs up, expanding the chest cavity. And that is the end of the lecture.